Welcome and namaskar. Today we will be talking to a very special guest who is in our studio, and let me tell you something, talking to her you'll feel like, she definitely is a medical expert with compassionate care. So I am talking about Dr. Kaumudi Somnay, who has over 3 decades of experience as a certified gastroenterologist. And Dr. Somnay, she brings a wealth of knowledge and skills from her prestigious training at Brigham and Women's Hospital, Harvard Medical School, to her esteemed faculty positions at Johns Hopkins University School of Medicine and SUNY Downstate, and most recently as a member of the GI faculty at Weill Cornell, New York Presbyterian, Queens. And Dr. Somnay's journey in the field of gastroenterology has been nothing short of remarkable. As a recipient of prestigious awards such as the Patient's Choice Award and Compassionate Doctor Recognition, Dr. Somnay's commitment to her patients' well-being shines through in every aspect of her practice. So without further ado, let me welcome her to ITV Gold Studio. Welcome, namaskar.
Namaskar, Priya. Thank you for that wonderful introduction. I am very flattered. Thank you.
Thank you so much for coming to the studio. It's an honor to have you. First of all, I'm really interested in knowing the meaning of your first name.
So it's Kaumudi. And this was a name given to me by my grandmother because I was born on a full moon day. So here they might think I'm a lunatic, but back home it's considered very auspicious. And that's how I was named Kaumudi, which means moonlight. So that's how I have this complicated first name, Kaumudi.
So Kaumudi, I want to know what inspired you to become a gastroenterologist.
So, Pia, when I came here around 35 years ago, I finished my med school at Mumbai in the St. G.S. Medical College, and then I came here for postgraduate studies. And I wanted to do internal medicine, and I was staying with my brother. And he used to just order fast food all the time. And for a while it was very appetizing, pizzas, burgers, colas, fries. But after a while it started taking a toll on me, and my stomach is very sensitive. And then I started feeling that. So I went back to cooking our dal sabzi at home. And after I finished my internal medicine residency, since stomach was still my issue, I decided to pursue gastroenterology, and luckily I got a fellowship at Harvard Medical School, Brigham and Women's Hospital.
You have done like amazing.
Thank you.
So today we are definitely talking about colon cancer. So I want to know from you, what is colon cancer and who is at elevated risk?
So basically, colon is the large intestine. It's divided into ascending colon, transverse colon, descending colon, sigmoid and rectum. And it's important because there are various tests that we do for colon cancer, which we'll discuss later. So colon cancer is a disease of the colon which arises, most of these colon cancers arise from growths called polyps that are small growths in the colon that usually when we pick up through these tests, the screening tests that we do, we can actually prevent colon cancer. So colon cancer is a very preventable disease because when we do screening for colon cancer, we can pick it up before it can manifest as cancer. So in the very initial stages, which are called polyps, is when we can pick up colon polyps and remove them and hence prevent colon cancer.
So is it like polyps are always like cancerous, or are they benign too?
So they start off as benign growths and then they get transformed, what we call adenomatous polyps, and then they grow into cancer.
Okay. So I also want to know from you, like, as you are talking about it, is like, suppose somebody is diagnosed with colon cancer, is it like preventable and treatable, and what diagnostic tests are recommended and who administers them?
So basically, the risk for colon cancer is increases with age. So anybody above the age of 45 is best recommended to have a screening for colon cancer. So the risk increases with patients' bad lifestyles like having a low fiber diet, having a sedentary lifestyle, being overweight, drinking alcohol, using tobacco. These are all risk factors for colon cancer. Also, there are certain conditions like a personal or family history of colorectal cancer or polyps, or some genetic disorders like familial adenomatous polyposis or HNPCC, which are conditions that can predispose to colon cancer. And also there is a condition called inflammatory bowel disease, which actually comprises of two main diseases, Crohn's and ulcerative colitis. And these patients are also at increased risk for colon cancer.
So tell me, how can like a common person like me who has no idea about, all these medical things, how do you know, and how can I know that, hey, I need to go and I need to get myself checked for colon cancer?
So in the US, just recently, the US Preventative Task Force has made the age for colon cancer screening from 45. So as soon as you turn 45, you should have a screening test for colon cancer. So these are of various types. One is the stool tests, and then the others are the endoscopic tests. So the stool tests can be for blood that we check in the stool, or they could be immunological tests, what we call fecal immunochemistry tests, or we can look for altered DNA in the stool. So these are stool tests. And then for the endoscopic tests, we have colonoscopy, which is the gold standard because it allows the doctor to get an entire look at the colon. And once we see these precancerous lesions, we take them out so as to prevent growth of colon cancer. So not only are we looking for these, we can actually treat them at the same time so as to prevent the progression to colon cancer. So the other test, which is also an endoscopic test, is a sigmoidoscopy, which, as I was telling you before, since it's a shorter test, it sees the colon only partially and not all the way like the colonoscopy does. So a flexible sigmoidoscopy has to be done every 5 years together with the fecal occult blood testing. And for the colonoscopy, if your test is negative and the doctor hasn't found any polyps on you, then you're set for 10 years. So you don't need a screening test unless you develop any signs or symptoms like bleeding per rectum or blood in your stool, change in your bowel habits, anemia, which is a low blood count, unintentional weight loss. These are the things that would then make you go for a test again, especially a colonoscopy, because the stool tests, if they come positive, then also you need a colonoscopy because you need to investigate why you had the blood in stool, or why the immunochemistry test for the antibodies for blood was positive, or why the DNA test was positive. So these are the things that you have to follow per guidelines set by the national standards.
So, Dr. Somnay, since you are talking about these colonoscopy and all these tests getting done, are there any like risks or side effects associated with it?
So yes, so like we broke it down into stool tests and endoscopic tests. So the stool tests, the risk is you can miss a cancer because if you don't get the test positive, if the fecal test is negative, then that doesn't necessarily mean that there is no polyp or no precancerous growth or no cancer. So the chances are higher that, if we can do it every year, there is a more chance that we could catch it. And with the endoscopic procedures like colonoscopy, the most serious complications are perforation, which is a tear in the bowel wall, which is very uncommon. It occurs in about 3 per 10,000 or so, and it's usually in the setting of having removed a big polyp, or if the patient has had multiple surgeries and they have adhesions. Sometimes the scope can also cause a perforation. And the other significant risk is bleeding. So also that can occur if a polyp is removed, because sometimes the stalk has a blood vessel that can bleed. Usually it stops by itself, but it can also manifest as delayed bleeding. So we have to watch out for any signs of bleeding. And if the bleeding doesn't stop, then we go back in there and we treat the area that was where the polyp was removed.
So we just talked about the risks and side effects which accompany these tests. So let's talk about the treatment options. And are there any side effects with the treatment options or not?
So the key is to try and diagnose these tumors when they are in their initial stages. So as I was mentioning to you before, if we catch them in the polypoid stage, even if there is cancer in that, if it's all resected endoscopically, the survival is almost 100%. But if the tumor has then invaded into the bowel wall, then surgery is a necessary treatment. And depending on what they find at surgery, whether it was just in the wall or it had spread beyond that, the lymph nodes, according to that, the prognosis will vary. So surgery is the next option, and chemotherapy is another option if the cancer has spread to the lymph nodes. Then the patient needs either chemotherapy or radiation. And there are also now targeted therapies that are available that are highly effective.
Okay.
So again, it depends on when the cancer was picked up, because if it was all surgically removable, then the survival is almost 91% in a quoted study. If it has spread to the lymph nodes, then the survival goes down a little bit to 73%. And if the cancer has spread to distant organs, then the survival goes down even more to around 14%. But nowadays, even if the cancer has spread to the liver or the lung and there are isolated lesions, we can still remove that and enhance the prognosis of the patient.
So talking about this again, about the colon treatment, what is if somebody's gone through the treatment, what is the recovery time for the patient?
So again, it would differ on what treatment the patient has received. So at what stage the patient is, which is highly complex, because we do a whole staging protocol on CTs with PET CTs, that's to know, where the tumor is spread. Depending on the stage of the tumor, would be the recovery. So, if the surgery was extensive, then the recovery is going to be more delayed. If the patient needs chemotherapy, needs radiation therapy, depending on those side effects that the patient experiences, the recovery is going to vary.
Doctor, I have heard that, I'm not sure, though you probably are the best person I'm asking you, is there an increased incidence of, especially within the South Asian community, to, have this kind of cancer?
Right. So there was a study between 2004 and 2014 that said that the cancer risk for South Asians had increased about 20%. And this is because of changing lifestyles. South Asians are adapting more to the Western form of living for diet, not exercising as much. Smoking, alcohol, all these factors are contributing. Plus, the South Asians, for some reason, believe that this is a disease of the West. It's not going to affect them. And if they have, transitioned to the Western lifestyle, they're going to be at the same risk as anybody else is.
So do you mean like food? Definitely, it plays a big part.
Right.
And they all say what you eat.
Absolutely. So the diet is critical, and also and they don't avail themselves of these screening tests that are available because they are invasive, they are less informed, they're not as knowledgeable about what is offered. So that's why we are spreading all this awareness so as to get more and more South Asians on board and have their screening as soon as possible.
And talking about the increased incidence of colon cancer, I think they are saying by 2030 something that it will be the primary cause of cancer deaths among individuals, right? So
among the people who are less than 50 years of age.
Wow.
So they are projecting that by 2030, more than 27,000 patients would be diagnosed with colorectal cancer. So that's the reason why the screening age was now dropped from 50, which we used to in the past, to 45 to try and pick up these patients even more than before. So because it's said that now below the age of 50, this is actually the number one cancer-related mortality in men, and the second cause of mortality in females after breast cancer. So it's now shifting to the younger population because they were not getting screened, and I guess because of the revised guidelines, we hope to reverse the prediction of so many added cases, and hopefully we should be finding more and more cases ahead of time. And also it is critical that it's not just the screening, but if there are any symptoms at all, such as blood in the stool or change in the bowel habits, like there is patients sometimes report that they used to have a regular bowel movement every day, and then suddenly they are constipated, or there's what we call pencil thinning of the stools, meaning the stools are now coming thinner than they should, or there is
or even change of color, right, in the bowel movement?
Well, if there is color change, like bloody stools or black stools, that's already a warning sign that something is really bad. But anything also to suggest from their primary care doctors, if the blood counts are dropping, because these cancers bleed, and that's how patients who are anemic should also be referred right away for colon cancer detection.
So absolutely, to all our ITV Gold viewers, as doctor is saying that it's very important. I would say at the age of 45, make sure you get the screening done. It's like always we neglect our health, but make sure you do that because it's very, very important to be healthy and be strong all the time. So lastly, I want to ask you an advice you would like to give to our viewers to maintain a healthy digestive system.
So eat plenty of fiber in the form of fresh fruits and vegetables, drink plenty of water, exercise regularly, keep in touch with your doctor, your primary care doctor and your gastroenterologist. Make sure that you are meeting the guidelines, you're up to date with your guidelines for screening, and rest, be grateful.
How about greasy food?
Oh, fatty foods are absolutely bad. So avoid fatty foods.
Because these days they have this fad coming up of having ghee. They have this fad, okay, we should have one day ghee is in, next day something else.
If you had a choice between all the fats, ghee is of course the preferred. And
but don't you think ghee is like, it might be good, but it's going to bother your some other thing, like your cholesterol can
you need some fats. It's not like you're going to be totally out of, so if you have to,
in moderation.
Absolutely. So If you were to pick one fat,
Ghee is the
I
fat.
would give you the ghee.
All right.
But again, in moderation, you have to be very careful about that. Now, avoiding toxins like smoking, alcohol, drinking plenty of water, exercising regularly, and then being grateful for the things you have. The attitude is also very important. That keeps you healthy, keeps you going, and staying happy.
Absolutely. I think happiness is the key to everything. And lastly, I want you to tell our viewers, if they are interested in coming to you and getting advice from you, where can they go?
So I have, I hold a faculty position at New York Presbyterian, but I have my own clinics in Flushing, right across from New York Presbyterian Queens, and one in Valley Stream, New York. So anybody is welcome. I have a site also, which is drsomnay.com. So feel free to go on that and give us a call.
Thank you so much, Doctor. It was a pleasure talking to you.
It was a pleasure. Thank you, Pierre, for this kind invitation.
Thank you.